It's been more than 50 years since Dr. William Feinblum invented bioptic telescopic glasses. During that time, thousands and thousands of people around the world have been able to lead more normal lives because of the improved vision that they've enjoyed with their bioptic glasses. Since then, there have been many improvements, and that we now have many options to offer people to suit the needs of their level of vision, as well as their goals in life. This is a more modern type of bioptic telescopic glasses. Like all bioptic glasses, the telescopes are mounted at the top of the carrier lens. Both the carrier lens and the telescope include the individual's prescription. These are helpful for distance vision, activities like recognizing people's faces, watching sports, watching television, watching your grandchildren play ball. In many states, including Virginia, people can be licensed to drive with bioptic telescopic glasses. So they're very useful for people who need improved distance vision. Another type of bioptic telescopic glasses has the interesting feature that the telescopes can be flipped up out of the way, so the individual can have them in position when they need them. They can have them out of the position if they don't need them, so they flip up out of the way. These are bioptic telescopic glasses which are focusable. This one magnifies 4 times and is focusable by turning this little knob. It can be focused all the way from optical infinity, a very great distance, to as close as 1.5 feet or 2 feet from the person's face. So in addition to things like driving and watching sports and the other things I mentioned earlier, this could be used, for example, in a grocery store, not only to see the signs at the end of the rows, but also to look at the prices on the shelf. This is one of the latest types of bioptic telescopic glasses. This particular pair is autofocus. It's battery operated, and has the interesting feature that when you look at something at a distance, the focus snaps right in. When you look at something up close, it snaps right into focus. So wherever you aim it, immediately comes into focus. So that is very useful for people who are doing activities that include a lot of different distances. Not all telescopic glasses are bioptics. As you can see, this pair is mounted lower in the frame, and that allows the person to look right straight ahead through the telescope. These are wide-angle 1.7x telescopes, which are very nice for watching television. And they can also be modified by adding an additional lens to the front of them that makes them focus at the computer screen, and they work very nicely for that. Now, I have my prescription, my personal prescription, in this pair and this pair. And the reason I have that is that I want to have the experience that my patient has when they're using it. It makes it easier for me to explain to them if I've done it myself. So I've driven with them, I've ridden my bike with them, I've watched live theater, I've watched my grandchildren play ball, other sports, and I understand how they're used, I understand who they will help, and I understand when to prescribe which type lens for that particular individual. So by the use of telescopic glasses, bioptic or the other type that I showed you that was mounted centrally, it can make a great deal of improvement for someone with reduced vision.